Our next speaker is Dr. Damien Howard. Damien is a Darwin-based psychologist and educator who has worked with Indigenous people in the Northern Territory for over 30 years. He has been researching the social and education outcomes for over 15 years. Damien.
Thank you. I'd like to acknowledge that we're on Aboriginal land and also note the importance of that connection to land for Indigenous wellbeing. I'm going to talk to you today about a bit of an overview about the impact that Indigenous hearing loss has on Aboriginal people's social inclusion and capacity to access services provided by agencies. Most people will know about hearing loss in terms of Aboriginal children, and up to 80% of Indigenous children experience hearing loss at any point in time in remote communities. And that hearing loss comes from middle ear disease, from otitis media. It's commonly known as glue, and it's one of the most common reasons that children visit doctors, and it results in conductive hearing loss. And it's often seen as a minor health problem. And the hearing loss results from the build-up of pus in the middle ear, stopping sound being conducted through the middle ear and being heard effectively. So people are not deaf, but they just have less capacity to hear, particularly in noisy situations. And sometimes the eardrum will burst, and children have runny ears, which again means that they're not able to hear effectively. Around about 1/3 of children in mainstream white classrooms in Darwin, Melbourne, elsewhere have hearing loss in those early childhood classrooms. So it's an important issue in mainstream education, but it's a massive problem in Indigenous education because 40 to 90% of children in Aboriginal classrooms, particularly in remote areas, have hearing loss at any point in time. And it's very much a disease of disadvantage. The reason why that prevalence level is so high in Indigenous communities is that they're crowded housing, poor nutrition, poor access to medical treatment. So those issues of poverty contribute to disadvantage in multiple ways, and one of them is in terms of a higher incidence of hearing loss that then flows on into education, employment, and those social outcomes of hearing loss then contribute to more poverty. So the persistent middle ear disease leads to repeated conductive hearing loss during childhood, and there's a secondary condition too called auditory processing problems, where after the hearing loss may have resolved, children can still have difficulties with background noise because of the deprivation of sound during the development of their neurological pathways. So there is often a double whammy of hearing loss and auditory processing problems. And the scarring caused by that persistent hearing loss often leaves some degree of permanent hearing loss amongst Aboriginal children and adults. And it's important to realise that most people are not deaf. There's certainly a much higher proportion of Aboriginal people who are deaf, but the partial hearing loss, the mild to moderate levels of hearing loss, are often very invisible. And that invisibility is in fact part of the problem, because when people don't know that someone has a hearing loss, they're more likely to see the difficulties in responding, the being very shy, the being very aggressive, as due to personality features, defiance, a whole range of things, rather than hearing loss. Some of the signs of hearing problems are that people find it easier to understand when something's shown rather than just explained. People get frustrated or anxious when there are high listening demands. People who are very shy and easily shamed. And people who avoid doing things if they're unsure what to do, or need more explanation than others, or who are very uncomfortable with new people. People who talk very little, or talk a lot and dominate the conversations. And I'm sure, looking at all of those indicators, there's probably a lot of people that you've worked with that you're thinking, oh my gosh, you know, I know people who responded in this way, and I didn't really consider that hearing loss was an issue. Most often people consider that it's about cultural differences or language differences that people are responding in these ways. And those three, culture, language and listening, are very closely interrelated. What Indigenous people with hearing loss experience is firstly a lot of frustration and anxiety. When people don't know what's going on because they don't hear well, they experience more frustration than others. And they often don't hear everything and constantly are having to work to think what that person may have said to fill in the gaps of what they heard. And that listening and frustration and anxiety then flows back on each other. So when someone's more anxious, it's harder to actually focus and attend to what's being heard. So when someone's anxious, the hearing loss has an even bigger part in terms of knowing what's being said. And people are most anxious when they're dealing with unfamiliar non-Aboriginal people, such as service providers for many agencies. Also, listening is very tiring if people have a hearing loss. People tire quickly because it's much harder for them to listen. It's especially hard if the topic's unknown and the person delivering it is also unfamiliar. Also, people who speak quickly, quietly, with an accent, or use unfamiliar words. And a common response in that situation is tuning out. So it's very common that people will focus for some time and then it just gets too tiring, too boring, and people tune out. And you often see that change where people aren't engaged anymore. And it's often seen, well, they're not really interested, are they? You know, they're not motivated for this. Not realising that it's much harder work for people with hearing loss to actually engage and listen, particularly for long term, and when the listening is made hard by a range of factors that I'll talk